Welcome, everybody. You can move up closer if you want. I'll make you all participate.
Tell them there's going to be a test at the end.
No, there'll be a test at the beginning.
Oh, at the beginning, all right.
All right. So when Connie asked me to give a talk, she had me look through the manual that you have for the course. And, you know, I didn't find something that I really wanted to talk about. I wanted to talk about something I really love. That's bones. And it's really interesting because, you know, when you think of a bone, usually you think of a bone you find out in the field, you know? Those are the bones we see. We don't see our own bones, okay? And the bone in the field is a dead bone. And the bones that are in our body are not dead at all. It's an amazing, complex organ, and people don't think of it as that way. You know, they just think, well, it's the skeleton. But you know, this skeleton is dynamic and it's changing constantly. You know, it's very much like a reef. You know, a reef is alive. And when you cut through a bone in surgery, it looks very much like the matrix of a reef. And of course, it depends on what part of the bone you cut. But the ends of the bones have a metaphyseal bone, and it's just this beautiful, you know, pattern. It's geometric, and it varies from person to person. In fact, for a while I was taking my camera to the OR and having them take pictures when I cut the top of the tibia off. Just to take a picture of the tibia, it's just a beautiful thing. And it varies. You know, some people, when I need to punch a hole in the tibia, it takes a hammer to punch the hole. And other people, I can just push it in with my hand. Okay? So there's a huge difference in bone. And the thing we always worry about, and the questions I get in the office all the time, what about my bone density study? It's osteopenia or osteoporosis, okay? And so that's a hot topic. And so you have to kind of step back and think about, well, what are the building blocks of the bone? You know? Somebody want to name one?
Osteoblast.
No, the building blocks. What?
Calcium?
Calcium. All right. What's another one?
Bone marrow.
Okay, that's bone marrow is bone. Yeah, I'm talking about the building blocks. There's 5 of them.
Magnesium?
Magnesium, my goodness.
Potassium.
65% of all the magnesium in the body is contained in the bone. And it's really interesting because magnesium does things other than just bone metabolism. It's very important with regards to the heart rhythm. And we find that patients who have low magnesium levels have arrhythmias, cardiac arrhythmias. And so we check magnesium levels all the time. And guess what? I would say about 50% of the people we check have extremely low magnesium levels. Okay? So it's an important thing to keep your magnesium level up, and there's a correlation between magnesium intake, okay, and bone density or bone strength. So it's important. What's another one for the bone? You know, 5 things.
Calcium.
What? Calcium, what else? Think about the building blocks. Vitamin D. All right, we put vitamin D here. Which vitamin D?
Oh,
2 or 3?
3.
3. D3, okay. Hey, we're getting there. Okay. What's another one?
Calcium.
What?
Calcium.
Well, you get calcium right up there.
Vitamin K.
Oh my goodness. And vitamin K. Oh, we got 4 of them. Is it K1 or K2?
I don't know that one.
K2. Where's K2 come from? Where?
Carrots. Celery.
I'll tell you where it comes from.
Liver? The
And it's
kidney?
getting the deficits in K are becoming greater all the time because we don't
Sunlight.
eat fermented vegetables anymore like sauerkraut.
Oh.
Okay? All right?
Oh.
Okay? And there's one other one in here. Starts with a B. B.
Beta carotene.
Boron.
Oh.
Who said that? Oh, boron. She's right. Boron comes from green leafy vegetables. Okay? All right?
Wow.
Okay. So it's kind of interesting, and so we talk about calcium. How are we going to get extra calcium if we need it? What are we going to take?
It's like dairy. A lot of people say
What?
Parsley.
Parsley, okay, all right.
cruciferous
Vegetables,
veggies.
great. Okay.
Kale. Yeah.
Kale, oh, kale, that's great.
Yeah.
All right. So it's really interesting because I have people who want to get extra calcium and they take Tums.
Oh. Wow.
Now, if you take a Tums are calcium carbonate. What's calcium carbonate?
Chalk.
Limestone. Limestone. And you can watch those tablets go right through the bowel on the x-rays. You can actually get a bowel transit time by taking x-rays and serum. See? Okay, all right. So that doesn't work. Okay, calcium citrate. You ever heard of that? Citracal? Anybody remember Paul Harvey? Paul Harvey used to advertise Citracal all the time. Okay? And the boron, we know where we're going to get that from the green leafy vegetables. Vitamin D, where's that going to come from?
Sunshine. Some of it.
Sunshine. Okay. So what are the vitamin D levels in the United States of America?
About 15%.
Way down. Because we're not exposed. We're northern latitudes. Okay? And where do we work?
Inside.
Inside. We can't get outside. So vitamin D levels are low. Okay? Now, vitamin K, I guess you'll have to eat sauerkraut or something like that. Okay? Or maybe take a little supplement. Anyway, it's fascinating when you think about the building blocks. And so now the thing to look at are what are the keys to healthy bone? Keys. One, what is it? Using them. How are we going to use them?
Weight bear.
Being active. Axial loading, weight-bearing activity. You know, I remember President Kennedy he did an executive order. You remember that? I remember it because I was in college. Okay? All right? And his executive order was to have a healthy nation of young people that were healthy and exercising, and boy did we exercise. I mean, that was the thing, and everybody was jogging, and this guy wrote a book on aerobic exercise, Colonel Cooper from Canada. It was the only way to have a good heart was to have aerobic exercise, okay? By the way, he's recanted. So now he has 2 total knees, okay? All right? He thinks there may be a better way, okay? All right, so exercise, and it has to be axial loading exercise. So I remember when my draft number came up and I was thinking about getting drafted, and you know, a conscientious objector, and one of the options you could go to white coat, so you could be a medic and all of that, and somehow I got deferred because I was in medical school if I agreed to be drafted when I finished. But the interesting thing was some of the white coats that I knew were sent down to Houston and they were put at bed rest. And they took serial scans of their calcaneus to measure the bone density, and in 6 months their bone density just went to nothing practically. You know, it's amazing. So That's how they spent their military time. It was in bed. Right? But this was for a reason. It had to do with space. Okay? What were they going to do with the astronauts that were in space? What do you think happens to their bones?
Kind of goes away.
Their bone density really goes fast, okay? And so they did all sorts of experiments, okay? They got vibrating plates, and they put the turkeys on the vibrating plates to see how much it could increase their bone density. Because you know, if you stand on a vibrating plate, that's going to be an axial load. And, but it doesn't work real good in space, you know, because you have to strap yourself down to it, okay? And so, at any rate, I know a neurophysiologist, okay, who I took care of as a patient. And she'd read this research, and so she went to the golf club on the internet and bought a vibrating plate with a stand that she could stand on. And she stood on it for 20 minutes, twice a day, and raised her T-score on her bone density study by 1 point, which is amazing, you know? Because it's hard to get your T-score to go up, it really is. So, a vibrating plate, you know? And a few people have tried that, but, you know, do you have time to stand on a vibrating plate for 20 minutes a day? The best thing is to walk, okay, and be active, okay? So the next key, okay, to healthy bones, what's it going to be? What would you say?
Diet? I mean, it's going to be
Okay. What's going to make unhealthy bones? Well, I get involved in that, but that's a whole nother topic. Healing bones is a whole nother fascinating topic. No tobacco. Why?
oxygen.
Oxygen content and transport, okay? One cigarette will turn your soft tissue metabolism to anaerobic, that means no oxygen, for 6 hours. So 4 cigarettes a day is all it takes. Okay, now I see this more importantly in healing. Fractures if patients smoke don't heal, okay? What's another thing you'd kind of want to avoid?
Alcohol.
There you go. No ETOH, okay? All right. What's another thing? Soda. Pop. Okay?
Carbonation. Is it carbonation or
It's not the carbonation. No, it has to do with the carbonation. It really does. Yeah. That's right. Waste phosphorus. Yeah. Okay. What's the thing that's really important? We've talked about the keys. Okay. We're going to put calcium intake. All right. Vitamin D. We talked about that. Vitamin K. And we talked about magnesium and boron. So having a good, well-balanced diet. Okay? So bone metabolism is more complicated, you know, and this is the trouble. We're kind of like Ponce de Leon. We're looking for the fountain of youth, you know. We want one thing. But bone metabolism is dependent on a whole lot of things. Thyroid. If you're hyperthyroid or hypothyroid, it will affect your bone metabolism. Hyperthyroid, the bones will just kind of wash away. I had a kid in traction for 6 weeks waiting for a femur to heal. Wouldn't heal, wouldn't heal, wouldn't heal, and lo and behold, he was hyperthyroid. You know? So thyroid, the parathyroid glands, and you know what? If you were to plot these hormones, none of them are straight lines. They're not there all the time. They come and go at different times of the day. They're up and down and all of that. So you got the parathyroid glands that are important in the metabolism of the bone. There's some other hormones. It's a long list of hormones. Testosterone, estrogen, progesterone, and you know how these things cycle around, okay? All right? So these are all determinants in how our bone metabolizes. And so if you were to try to make a medication that duplicated this, it's impossible. There is no one pill solution, okay? And I have patients come into the office all the time and they're asking me about the pills, okay? And there's 3 classes. The original one was Fosamax, which was an aldonurate, okay? Reclassed, that's easy, you get it once a year IV, okay? But that's an aldonurate. And then there's Prolia, which is a parathormone peptide, okay? It doesn't include all of the parathormone, it's just several of the peptides which tend to promote bone growth. These 2 up here preserve old bone. And I can remember when they first came out, everybody was being prescribed Fosamax, okay? And you know it's just really easy to refill the prescriptions and keep them going, all right? About 5 years out, we started seeing atypical fractures, okay? It wasn't a usual fracture, it was more like a piece of chalk where it would just break across. And it started out, the patient would start complaining of pain in the thigh, and the next thing you know, they had an atypical fracture. So Fosamax you can't use for more than 5 years. You have to go on vacation after that. Reclassed and Prolia, you can only use for 1 to 2 years. Okay, so there is no cure. I mean, we're talking about stopgap measures, and the attempt of this, you know, if you were to, I was hoping to get the right colors here, but have any of you had a bone density study done? Okay, have you seen the results? Okay. Okay, all right. Well, but I just want to show you what happened here. This is a kind of a drug story. Maybe we shouldn't tell it here. Anyway, so if you look at the graph, okay, it's like this. This is age, and this is bone density, okay? All right. And this graph is divided into 3 zones. This is green, this is yellow, and down here at the bottom is red, okay? So this is normal density. This word, by the way, was created by the company that made Fosamax. It's called osteopenia, okay? That word wasn't ever in the dictionary till Fosamax was made. And Hologic is the people who made the scanners for the bone density study, and the manufacturer for the Fosamax said, we want you to report this in a certain way, okay? And so you can plot a curve as we get older, let's say out here at 100, okay? So it goes along like this. The curve goes this way. And then for males, it's a steady drop. For females, you get out here to about 45 and something happens, okay? And then it levels out again, okay? And then if you look at the form, there's 3 lines that follow along there, okay, like this. And this is the median, and 1 standard deviation on either side is the average, which is a C, right? Okay, the average and the curve. So it's what happens then as you move out into here, almost everybody ends up going through the osteopenia line. And the alarms go off, okay? So everybody starts thinking about doing something with it. But if you go far enough, everybody becomes osteoporotic, okay? All right? And this is an average. So an individual case, it's somewhat valuable in predicting the likelihood of having a fracture. And that's something we don't want to have. And I want to talk to you about why we don't want to have that. We don't want to have a fracture because it can become a major alteration in your life. I mean, major. In fact, if you just look at fractured hips, just hips. Now, there's a lot of bones in the body, but let's just talk about a hip fracture, because I see them all the time. Okay? And a hip fracture, if I was the President of the United States, I would write an executive order. Because they like to do that now, you know, okay? And my executive order would be that everybody over the age of 50 was on a mandatory balance exercise program. Because if you don't fall, you're not going to break it. Okay, that's the first thing. So at any rate, if you look at just hip fractures, the direct cost on hip fractures per year in the United States, and there's 150,000 of them, and this is old data, by the way. There's no new data, because I don't think the INH is working anymore. But this is all old data. It's $17 billion a year, direct cost for hospitals, rehab centers, physicians, and all of that. That's a whale of a cost. It's predicted to double, okay, by 2030. So, you know, and that's just because there's more of us, okay? But hip fracture is an interesting thing because with a hip fracture comes a lot of morbidity, and that's not counted in these numbers. They figure that probably it's twice that when you look at the overall morbidity and difficulty for the patients who've had the hip fracture, and the family and everything that goes along with that. It's more expensive than just the numbers that we have from the medical side. Okay. So that's one thing I want to talk to you about. Okay, is balance. You know, when we're born, we have no balance. None. Can't sit up, can't stand up, can't pull up, okay? Nothing, okay? Except cry. Get attention, okay? But it's what happens is along in about a year, maybe a little later, they're pulling up on the side of the chair, and they'll take a few steps. They're imitating mom and dad, and they'll fall on their butt, and just, it doesn't hurt a bit. They just, doesn't hurt them a bit because they didn't fall very far.
No,
okay?
true.
And they kind of become, and we all do, we become fascinated with balance. I've gone out and walked down a railroad track just to see how far I could go and stay on the railroad track, you know? And so we play with it. We get on skates and skateboards and all sorts of orthopedic trauma creating equipment, okay?
Job security.
Job security. Yeah, okay. And they got those new electric ones now. I can't believe it. And there's one that just has one wheel under it. It's amazing what that thing does. You know, but anyway, and then bicycles and everything. And then we end up finding a mate. We get married. We get busy. We're raising kids. And our focus changes. We don't play anymore, you know. We're too busy. And our balance gets worse because we're not what? Practicing it. Okay, we're not playing with it anymore. And so as our balance gets worse, you know, if it really gets bad, you know, you start looking down. This is the first thing. Start looking down because you're afraid you might fall. and you can't pick your feet up. You gotta kind of shuffle along. And that guarantees that you're gonna fall and go down. Okay, you trip on something. The major cause of fractures that I see are pets and throw rugs. Those two things. Pets, dogs, cats, anything that trips you up, and throw rugs in the house. Probably the worst thing you can have is a throw rug, because you'll catch your foot on it and go down. Okay? And so the best solution I know of, okay, is 3 times a day, every time you eat, practice balance. How are you going to do that? Stand on one foot. That's right. As long as you can. Okay? And you'll find out that it gets longer and longer, and then once you get really good at it, you can start shifting your balance.
Right.
Okay? And the other thing is by marching when you walk. Pick your feet up. Don't put them down. You play like a bird. Okay? Those are things that you can do to improve your balance. Okay? And if you improve your balance, then you won't have to come and see me. Okay? So I think those are the important things that I have to say about bone health, okay? You know? And there is no magic pill, okay? There's no magic pill. It has to do with lifestyle. Any questions?
Yes, I've heard that Fosamax eats holes in a person's stomach.
Well, it can irritate the stomach. It really can. But, you know, the real problem with Fosamax, if you want to look it up and research it on the internet, is problems with dental, you know, resorption of the mandible and all of those things. Because it's what you're doing is you're stopping a normal process. You know, the osteoclasts are constantly breaking down the bone, and the osteoblasts come right along behind and build new bone. And they build that bone based on the lines of stress that are going through the bone. And so if you look at an x-ray of a hip, you'll see the ball, you'll see, you know, the bone is real dense right along the calcar, the bottom of the neck. And then there's these little strands of bone that you see that stand out, and they kind of go up into the head. Those are stress lines that bone knew how to build the architecture to support that structure. You know? So it's amazing. And so when you take a medicine that interferes with bone breakdown, is what you're doing is you're creating old bone, and that's why they get the atypical fractures. So.
One question about too much animal protein. Does that change the...
Well, you know, there is a myth that everybody needs milk. And it's on the back of the truck that goes down with this gorgeous gal on it. Okay, all right. Well, milk actually is going to, you know, waste calcium because of the metabolism of the protein. It takes calcium to do that. So it's a myth that everybody needs milk.
Does it have to do with your pH balance and your body trying to neutralize?
You know, I can't answer that question. I don't know. All I know is that it's a myth that, you know, you have to get your meat in order to build bone that won't work. You know? Yeah. Yeah.
Oh, go ahead. Go ahead, Marie. I'll be second.
For menopausal for women.
Okay.
Yeah, for hormonal replacement, the risk versus, you know, the side effects.
Well, you know, I think that that's always been a debate. Since I was in medical school, it's been debated. But I think that there's some holistic ways to go about dealing with that. But you can't just put somebody on a pill. Okay? If you're going to replace a hormone, you have to follow the levels. And, so you just can't write one script for everybody. And I think that you have to actually look at what the hormone levels are and figure out how it should be done. That's not part of my practice, but I know some people who do that, and I think it's important. I think it's important for bone health. I think it's important for cardiovascular function as well. Okay? But I don't just say that everybody should be on Premarin or whatever.
Dr. Bowen, they always say that the old saying or the myth is that every day that you're in the hospital will take a week to recover. Is that because the bones or the calcium in the body is beginning to?
No, that's just because you're in the hospital. I mean, you were there for a reason, man. It's going to take a while to get over it.
Yeah.
Yeah.
What about drinking things like bone marrow, making bone marrow soup rather than your soup broth?
I don't think that's not really a solution, I mean, you know what? I heard this. There was a big debate about taking, cartilage. Okay. Big debate about this a while back, and we were in a meeting, and they were debating whether or not these supplements helped. Okay. And a guy stood up in the back and he says, he says, if you believe that eating cartilage is going to make your cartilage better, maybe you should eat brains to get smarter.
Oh, no!
Okay,
wow.
and the point was, when you eat something like that, is what happens, the body breaks it down, it absorbs the proteins, everything that comes out of that, it goes to the liver, and the liver makes what it's making that day. It doesn't go directly anywhere. Okay, so, the liver's going to process anything you take in. It's going to be sent, I call it the chemical factory, and it's going to produce whatever it's producing to make the body work. And, this body is so complicated. The more I'm around and the more I see of it, the more I say, my goodness, this didn't just happen by accident.
Wow,
It's too complicated. Yeah.
My doctor has me taking magnesium oxide because I've had terrible cramps in my legs and I couldn't get out of bed, and it really works.
It does.
Don't get magnesium caltrate, get magnesium oxide.
No, if you get magnesium citrate, you'll be on the stool all the time. That's right.
There's a big difference.
There's a big difference. Yeah.
I was hearing good things about magnesium glycinate. Is there
Glycinate?
glycinate? Yeah.
Yeah.
Is there a difference between what she was saying? And
No. No, magnesium oxide is good for leg cramps, so
Sure helps.
yeah, it really does.
And it can make your legs better in like 20 minutes.
That's right. Yeah, it's pretty amazing. Yeah.
So what about potassium? Does it help at all with the muscles?
Potassium? Well,
Yes,
that's important for your muscle function. It sure is. In fact, it's just the heart is as sensitive to potassium as it is to magnesium.
Right.
You can't have a low potassium or a high potassium.
Not too much potassium.
It has to be just right. Yeah.
Yes, sir.
I was wondering, so when you're talking about weight-bearing exercises to increase your bone strength or density, bone density, is that a good idea to do all exercises that attach to all the bones, or is it just like the main muscle?
You're mainly dealing with the axial skeleton, yeah. And walking is probably the best exercise.
And what does axial refer to?
What?
What does axial refer to?
Axial this is an axial force. It goes all the way from here to there,
Okay.
all the way.
Okay.
And it's along the axial skeleton, yeah.
So jumping would be a good exercise.
Yeah, jumping rope, yeah.
Jump rope.
Or if you want to be easy on your knees, maybe a trampoline, jumping on a trampoline, yeah. Yeah.
Nice.
Hey,
Nice.
What about like swimming?
swimming?
Yeah.
Well, that's not really axial loading. It's not.
That's just no
That's for muscles, that's right. But it's not a good axial activity, you know. Yeah, you know, I think that, you know, the only way you get axial exercise is to walk, and I make sure I walk everywhere I go. I don't ride the elevator. I walk up and down the stairs no matter what. That's right. Yeah.
Yes, sir.
That's right. Any other questions? I think we've done our time.
Great. Fantastic.
Thank you, Dr. Bowen. There we go. Okay. Thank you, Dr. Bowen. It's really, really interesting. So next week, we will be having Connie will be presenting about the benefits of water. And she'll probably have some good demonstrations about maybe different ways of using water than you may be familiar with. But yeah, feel free if you have more questions for Dr. Bowen to hang out with him. And otherwise, we'll see you next week. Have a good one.